The School of Healthcare of Rishihood University here, we are looking forward to start a program on breastfeeding and lactation. Infant mortality is important because what happens just after birth. Right. And mother mortality happens till she delivers the baby, either during pregnancy or during the delivery itself. Yeah. It is proven globally, even modern science acknowledges it. Breastfeeding plays a very important role. Immunity you develop, the kind of nutritional input that you get, and this is a part of a tradition. Unfortunately, it has been forgotten in the quest of so-called modernity. How this can catalyze the whole role of lactation consultants and counselors in India. Very good afternoon, sir. The School of Healthcare of Rishihood University here, we are looking forward to start a global leadership program on breastfeeding and lactation. And primarily, we are looking at how this can catalyze the whole role of lactation consultants and counselors in India. Looking at, because you have been a member of parliament 4 times and you have worked at grassroots, how do you think we can actually improve the lactation scenario apart from the trainings and coaching that we are going to start here and a large course which we are going to build? So we look forward to your ideas on how we can improve the lactation status in India. Currently, we are at 41% early breastfeeding rate and only 60% in exclusive breastfeeding rate for 6 months. Firstly, Doctor, I must congratulate you for focusing on an issue as good as this. Thank you. For a long time, the government public health policy perspective has been to reduce infant mortality rate, maternal mortality rate, which is important. Infant mortality is important because what happens just after birth. Right. And mother mortality rate happens till she delivers the baby. Right. Either during pregnancy or during the delivery itself. Yeah. So that's very important. But then the whole purpose should be also, while focusing on mother and the infant, the growth of infant into a healthy child and healthy person eventually. So to do that, it is proven globally, even modern science acknowledges it, breastfeeding plays a very important role. The kind of immunity you develop, the kind of nutritional input that you get, it's not just the milk itself that the child drinks from the mother's breast, but also the care, the love, the attachment that goes with that. Absolutely. And the closeness, that bonding that happens through this entire process is something far more important. If you look at some of the old pictures of Lord Krishna, you'll see a breastfeeding by a mother. Right. So just imagine that this has been a long practiced tradition. Yeah. In our society. Yeah. And that's why we even don't mind our gods to be revered so much, to be seen in that position. Because he became God, but before that he was a child. Absolutely. And he wouldn't have grown into a God like that probably without affection, love, and a mother's breastfeeding him to do that. Yeah. And always remember one thing, anatomy. Our entire human body is developed to this stage through evolution. So nature has created a body structure for a woman with a purpose. Yeah. So breasts have a job to feed a child. That's an essential part of the human body. Right. So we must not ignore that, and this is a part of a tradition. Unfortunately, it has been forgotten in the quest of so-called modernity. Right. And we are giving them the best possible medicines to a child, best possible vitamins to the child, best possible supplements to the child, but not giving something so basic, right, which has been designed by nature, worshipped by us for our gods. So I think this is not difficult to practice because it was part of a tradition anyway. Right. We have some lost time in between, so we must refocus on it. And I'm very glad that Rishihood University School of Healthcare is going to focus on that. It's a very heartening
news for me. I would welcome this initiative. I think only way you can do this is propagating it, change the mindset. More you talk to people, more they will understand.
Right.
If you can give a live example, like I just come to my mind about Lord Krishna's old picture, you can see something.
Yeah.
You should try to highlight that also.
Right.
So people will attach it to the godliness.
Right.
In fact, God has said that mother is more important than God. In fact, Adi Shankaracharya, he was born to be a saint.
Right.
Not saint, but an extraordinary saint. He learned Vedas from ancient scriptures, knowledge from his father. His father passed away very early.
Right.
So his mother said, "You cannot go." He declared his intention of becoming a sannyasi.
Mm-hmm.
So mother started wailing, crying. He said, "I will not go unless you give me permission." Now that's a different story how he got a permission. I'm not getting to that. But that time Adi Shankaracharya said, "Your position is higher than Guru and God."
Mother's position.
So you are important and far more at a higher pedestal than God and Guru.
Absolutely.
So therefore I cannot do it unless you tell me to do it. So that's what the Sanatan Dharma is alive today because of a great contribution of Adi Shankaracharya.
Yeah.
So that was his thinking. So you should always remember that. And therefore mother not just gives birth to a child.
Right.
But she nourishes his childhood, makes him into a strong person through a process.
Absolutely.
And that one of the important process, physical process, is to breastfeed.
As a part of this course, as you rightly said, sir, we are thinking of a module called 𝗦𝗂𝗍𝗵, where the first 1,000 days of life of a baby, where even preconception and post-conception, where the mother, because she is more than a god, she is the person who is carrying the baby in the womb, nurturing the baby, and then giving birth, and then taking care of the baby. What we are thinking is, if this mother could be given some sort of a spiritual power, or spiritual training, where what sort of books she should read, what sort of music she should hear, what sort of nutrition she must have. And this sort of a training can be a module of this larger lactation and breastfeeding and nutrition course. Then the mothers also can benefit from basically this whole module. So what are your thoughts on this whole
𝗦𝗂𝗍𝗵? Very important thing. In the process of conception itself, post-conception, a child's behavior pattern is already established in the womb of a mother.
Right.
𝗦𝗂𝗍𝗵 learnt about, he was in the womb.
Yeah.
And he learnt about the art of penetrating the opposition army. But he couldn't hear the other part. And that's why he was trapped inside.
Yeah.
So just imagine the great warrior Abhimanyu learned the part of the art of war part, because he didn't know the exit part, from mother's womb.
Absolutely.
So what mothers reads, what mother thinks, what mother is giving that the affectionately or not, will create the character of a person, child to be born. So it's very important part of that. I must tell you something, sir. What is mother? See, we worship God because He's a creator.
Right.
So every mother is a creator. So she also has a godly role to play.
Absolutely.
So because she creates something far more important. In fact, there is a very interesting Hindi में, ये माँ तेरी सूरत से अलग भगवान की सूरत क्या होगी? तो ये, and he says that सब जितने भी भगवान हैं, आपके आंचल में तो पले हैं.
बिल्कुल.
Like I was giving example of So even Lord Rama, whose temple now we are going to worship there, he obeyed the order of his father and mother, because he said, no, she may be my stepmother, but she has said that I will do it.
So very very valid points that you have shared, regarding spiritual power that the mother has. And apart from this whole course on lactation and breastfeeding, as India has moved from infant mortality to infant intact survival, and because we have considerably reduced the infant mortality rate in the last 2 decades. Now, there is a need to look at the intact survival of the babies which we are saving now. In last 2 decades, we have established many newborn intensive care units where we are saving babies like 1000 grams or even 900, 800 grams. But unfortunately, we are not able to see whether that baby has good vision, good hearing, and how are his intellectual abilities, milestones are happening in the right way or not. So again, there is a huge need is what we think for starting a course on testing eyes and for hearing and improving the skills in the NICUs and labor rooms of all the hospitals. And this is there in the West is what we understand as mandatory screening before discharge. But in India, we have been now embarking this journey. And Rishihood School of Healthcare, we would want to start this course of universal newborn screening. Sir, how can we make universal newborn screening mandatory in India as a parliamentarian and as a reputed public?
I was also on the health committee of the parliament.
Sir.
Once a child is delivered, and we know the gender of a child, it's an excellent idea that we must have a proper screening process to ensure that if any deformity is there in the child, it can be corrected at the right time. Many of these health issues, if they are dealt with ab initio initially, they have better chance of addressing them, successfully addressing them, than delaying it.
Absolutely.
So that is absolutely correct idea. While before delivery, there is a regulation, but after it is delivered, there can be an insistence of carrying out such a test like this.
Thank you so much, sir. Universal newborn screening is a vision that we all foresee that in the future, this is something which we will do for all the 25 million children who are being born every year. And
Doctor, I must congratulate you because thinking of an issue as fundamental as this, which itself will prevent use of medication to a great extent, because people will not need medication. So I think that's one. Secondly, the healthy child is what every parent wants them to be. So, and that's the simplest way of doing it, a healthy child. And nature has actually made a human body, the woman body in that fashion for a particular purpose.
Absolutely.
So we cannot defy the law of nature. Nor we can not allow the child to receive the kind of love and affection that only mother can give. So I think we should do that. Thank you very much and congratulations.
Thank you so much, sir. Lastly, I have a pertinent question regarding the current scenario of Bharat. We have Ayushman Bharat scheme, which is one of the flagship projects of this new government, and which has covered 100% below poverty line population through the Ayushman Bharat. And all the out-of-pocket expenditure and catastrophic health expenditure that can happen in a family, which might lead to selling of their gold, ornaments, either family stock or livestock and all. And this has been a game changer. So, is there a need for a greater work in this area, because the universal health coverage has now been for the below poverty line population, and how about the above poverty line population, which can become BPL because of the expenditure? And how can India embark a journey of complete coverage of its whole population for this program, sir?
As you correctly said, people get into poverty. Only either poor cannot afford it is one part. But the medical cost is so high that people can turn into poverty because of it, medical cost to be incurred. So this is a very important means of doing that. We need this is part of a larger social security cover, which the government must offer to the citizens. So this is the first step, bigger step. It needs obviously numbers to be scaled up, more and more people to be brought under its net. How to finance it is an issue, and that also needs to be addressed properly. like many other countries in the world, insurance, like NHS in the United Kingdom,
Yeah.
is one of the shining example of how public health should be delivered.
Rightly said, sir. Yeah.
So not only UK citizens, rightfully so, because they are the taxpayers, even UK residents are eligible for receiving such benefits.
Absolutely true.
And this is completely free.
Right.
Free in a sense, it is financed from some other source.
Yeah.
And NHS is one of the largest employer in the world after national, the People's Chinese People's Army. So this is the second largest employer in the world. Many of them, doctors and health professionals, are Indian origin. So I think, like on the pattern of NHS, we need to think about something on a larger scale to be implemented over a period of time. Now the Medicare and Mediclaim system of US has also not succeeded in giving what is needed. Canada has also universal health system, a health insurance scheme. But I think one of the best models is NHS. I think we should think about introducing something like this over a period of time.
You're spot on, sir. I mean, your experience speaks of a tremendous understanding of the NHS model and how Medicare and Medicaid in US spend more than 18% of the GDP of US is spent on healthcare, but still it is not as robust as the NHS model. And as you rightly said, if we need to provide for the above poverty line population, we need to think of how to finance it.
Yeah.
And probably if people can be co-financers for the model, can we embark that journey of co-financing by the people and partly financing by the...
Yeah, obviously, it cannot be expected. See, basically, you say government will finance. Government, where do they get money from?
Absolutely.
It gets from the taxpayer anyway.
That's right.
So the beneficiaries,
Yeah,
who are beneficiaries of the system, direct beneficiaries, should also partly contribute if they can afford it.
right.
So therefore, we should devise a system how to finance it. But objective should be to work on each and every citizen of India should be covered by healthcare system, health insurance.
So we are also starting a course on universal health coverage and One Health at the Rishihood's School of Healthcare, sir. And we would probably do more research and also take many more inputs to see how we can help the policy framework in healthcare on this design also.
And anytime I'm always available. And I think this school should be the trigger for bringing in better policy changes at the healthcare system in the country.
Right.
So I wish you all the best.
Thank you so much, sir.